Good morning. Today we'll be talking about congenital defects, as they are more common than a lot of people might realize. Thank you, Dr. Ayeni and Dr. Sanusi, for coming on the program. It's a privilege to have you here with us.
Thank you for having us, Ma.
Thank you for inviting us.
Dr. Sanusi, in fact, it's
Be here.
actually a double privilege to have you with us because we'll be talking about the work that you've done as a diaspora doctor who came back to Nigeria and set up and has created a legacy which you have left behind. But we'll be diving into that shortly. If I can start with you, Dr. Ayeni. Dr. Ayeni, can you tell us what is a congenital defect and how common is it in Nigeria?
Okay. Congenital defects are any form of structural or functional abnormality. So it can also be a birth defect that a baby is born with. So the problem must have been acquired during the process of formation in the womb. And then when the baby is born, there is an obvious abnormality, either structurally or functionally. And it's not very common, but it's usually variable, depends on different locations. It's like 1 to 33 globally, but in Nigeria, it can range from as few as 1 in 10,000 to as much as more than 20% in a certain population. So it usually varies from one location to the other.
So can you tell us about congenital defects? Just a bit more about it. What are the common ones that are found?
Okay. So congenital defects, as I said, they can be
Maybe we should
structural or
start.
functional.
Maybe we should just, because I know it's such a broad topic. Maybe we can stick to the structural ones for now.
Okay. All right. The structural ones can be an abnormality, maybe in a structure in the body. It can be the brain, the heart, internal organs, the hands, the legs. There can be an entire loss or absence of a limb. There can be an abnormality of a shape. There can be an abnormal connection between one part of the heart and another. And the common functional one that is not always obvious initially is sickle cell anemia. It's also a congenital defect, but it's not really structural. So those are the common ones around. Then worldwide, there can be others like Down syndrome, and the one that is most common across board is congenital heart defect in different forms. There are some that are simple, some are very complex.
Yes, thank you so much. I think it's good to have an understanding of congenital defects. Can you tell us why they happen? Because some people say, it's not in my family, it's in somebody else's family, and all sorts of uh, you know, there's all this stigma and issues around it. But why does it happen? What makes it happen? Is it something that's preventable? Is it something that's not?
Okay, so the causes can be divided into at least three. So it can be genetic, that is something that is inherited. There may be some form of abnormality that is passed down from generations before, and that can affect the formation and development in the womb. Then it can also be because some chromosomes are occurring in too many forms. So that's also something that is inherited. And it can also be from the environment. So that means there can be some things, maybe the mother took a drug, or the mother is taking alcohol or tobacco smoking. Sometimes it could be radiation around. So things in the environment too can be teratogens. That's why when somebody is pregnant or is likely to get pregnant, there are some medicines that doctors know that is not applicable to that person because it can affect the formation of the baby in the womb. And at least I've seen one woman who was smoking shisha, and that was the reason for the baby's congenital malformation, which was a limb deformity. Then it can be a maternal condition, like if the woman has chronic hypertension or diabetes, that can also be a reason. And sometimes consanguinity, that is when close relatives marry, that's a high risk for genetic transfer abnormalities. So those are the main ways by which they occur. And one thing to note again is that once an abnormality occurs early in pregnancy, that abnormality can just go forward. So things only need to sway from normal slightly. And then if it happens early in pregnancy, it just continues like that until birth. And the baby will now come out with a gross or obvious abnormality, and it can affect any organ, as I've said before.
So that's often why, we often see our, we really have to thank God when, normal children are born and when there are no problems in children. And as I'm sure as a neonatologist, you see this all the time, and it must be very traumatic for families
Yes.
when it happens, isn't it?
Yes, certainly, ma. It's really traumatic, and of course, any mother will be very, very unhappy and anxious about the future. They want to know whether it's compatible with life, what it will cost to take care of them. As I said, some are simple, some can be really complex. And so it can be a lot of problem. And some of them can be something that will be carried lifelong. The problem can affect speech, some of them can affect intelligence. The baby, some of them may be totally mentally retarded for life. Some can be, and some are just gross abnormalities that can be repaired surgically or even a few with medicines. So it's a stress both on the healthcare givers and also the parents too. Healthcare givers, typically it will be only the neonatologist. There'll be need for calling other specialties into the care. So it's generally something that can be stressful.
And so we will talk about congenital heart defects. And if I could, I'd like to also bring Dr. Sanusi into the discussion here. Dr. Sanusi, in fact, first I'd like to just say thank you on behalf of all of us Nigerians for you coming back to Nigeria and being one of the pioneers in congenital heart surgery before yourself, and I think it was in Last Tooth, and then before you went to Tri-State to Babcock and all that. Everybody was always going to India. And everyone was getting on. In fact, there was this big issue. There was Kanu Foundation carrying children to India, carrying everybody to India. And for me, it's such a pride now that people don't have to go to India anymore. People can stay here in Nigeria and have these surgeries done successfully. So I want to say thank you to you. Thank you for the legacy that you've left and you brought. And we just want to also encourage others to come back and also do the same here in Nigeria. One of the things that we've noticed is that doctors from diaspora don't always want to stay in Lagos. They're happy to go, back home. They're happy to go, into other areas to set up and to make that impact. So thank you very much for that. So Dr. Sanusi, in your experience here in Nigeria, can you tell us about, how you found congenital heart problems within Nigeria and how you were able to start to tackle it?
Well, thanks, Pamela, again for inviting me to your program, Doctors on Air. There's really no need to thank me, a Nigerian, for coming to Nigeria to take care of Nigerians. And I think it's an honor to be able to contribute to healthcare in Nigeria. Um, Congenital heart defects are, as Dr. Ayeni said, quite common um, in all over the world and in Nigeria as well. And they really can be taken care of for the most part. And if they're not taken care of, it can really cause a lot of morbidity and mortality on the short or the long term. Um, Now, finding patients with congenital heart defects in Nigeria is not a problem at all. A lot of them have been diagnosed. The problem is was and still is the resources in taking care of them, because sometimes it's not cheap. Some of them are the simple congenital heart defects that can be taken care of maybe in a more cost effective, but most of them cost money to take care of because of the equipment that is needed to take care of.
We can just go back to Dr. Ayeni. Dr. Ayeni, can you describe, we just have a couple of minutes, some common congenital heart defects and how they present, because we're just talking about them generally. So I'd just like us to go and sort of dig deeper into one or two, challenges that we have, and just describe the children, how they present, so that our listeners here can pick up some of those cases and bring them in early if they see them.
Okay. In the early period, there is a likelihood of difficulty with breathing. Baby will be breathing with obvious difficulty. There can be a dark or purplish or bluish discoloration of the tongue and lips. The baby can be having air hunger. That's like a difficulty with breathing. And sometimes the baby may not be able to initiate and sustain breathing on his or her own because of the congenital problem. And then, because what happens is there's a normal connection between one place and the other. So there can be an overflow of blood to one side or mixing of deoxygenated blood with the other. So the heart is not functioning the way it should. So that affects the way it presents. But those are the common ways in the beginning. But later on in infancy, it may be that the child will not be able to tolerate any effort. Like baby wants to suck and gets tired easily, is able to sustain the effort, even the effort to breastfeed. Or later on, the baby sweats a lot, or the baby is not able to have enough energy to eat or suck at all. So those are the common ways it can present in the early period. Then as it goes on, there will now be issues peculiar to the kind of cardiac defect. Yes.
So it's clear that the congenital heart defect, but I mean, for example, we were talking about congenital heart defects. Titiloye, we mentioned, grew beautifully, became an international football star before his own was discovered. So obviously there are different levels when we're talking about this kind of problem. I think, if you can just give us a bit more information about the PDA.
All right, so PDA is an abnormal connection again that is persisting. That's why it's patent ductus arteriosus. That connection was there while the baby was still inside the mother. But once the baby is born, that connection is no more needed. So the way it should have happened in normal transition as God made it, that duct should close, should become obliterated. But in the problem that we're now talking about, PDA, it now persists. So it remains patent, and that allows blood to now flow. Blood that should have gone to the rest of the body, part of it would deviate into the lungs at a high pressure, so to overfill the lungs and cause a lot of pressure, and the lungs will be doing overwork. So like the baby that we are talking, whose mother is here, that was a problem. And for weeks until the medical drug that, because in that baby's case, we didn't need surgery. It was amenable because it wasn't a big hole. The medicine worked, and that was it. But until the thing closed, the medicine had to be used for 2 times over, and the baby was dependent on oxygen for the period. So that's how it may present if it's not, if it's still patent.
Yeah, thank you so much. So, Dr. Sanusi, if we can talk about the hole in the heart. The hole in the heart, that's what we're talking about now. And there are different kinds and shapes and sizes of holes in the heart. And you were telling us how easy or how hard it is, and the situation we are here in Nigeria with as regards this.
So just to build up on what Dr. Ayeni has talked about, so that different types of holes in the heart. There really there's the lower chambers of the heart, called the atrial, the upper chambers of the heart called the ventricle, and then above the heart is between the big vessels, we call them the great vessels of the heart. That's where you have things like PDA. So and they usually, so they're all holes in the heart. An example of one in the lower chamber is the atrial septal defect. One in the upper chamber is the ventricular septal defect, and then you have the PDA, which is supracardiac. So the thing is that with the different holes in the heart, they present differently. Some can present with heart failure, like a PDA would present. The baby has heart failure because there's so much blood going to the lungs. Normally, that during pregnancy, that PDA actually diverts blood from the lungs because the baby's using the mom's lungs. But once the baby starts to breathe with his or her own lungs, the blood, if that PDA doesn't close, the blood kind of flows back retrograde into the lungs and floods it, causing heart failure. Some of the congenital heart diseases they're called cyanotic heart diseases. They make the baby blue. So they don't necessarily cause heart failure, but the baby does not get oxygen. So the baby has no energy because oxygen is necessary for metabolism. And eventually that catches up with the baby. So those are the main things with the children that have heart failure will present with pneumonia, they cannot feed, they get tired. The people that are cyanotic, they cannot grow. Then if its cyanosis is bad enough, it causes other organ failures, kidney, livers, even can damage the brain. The brain doesn't develop well. It can
But
cause
the,
infections in the brain.
but the important thing is that now in Nigeria, these conditions can be treated, even
Yes.
though you were saying there are limitations because of funding. Can you tell us a bit more about it? Because I'm sure there are people out there who would be interested in supporting some of these conditions if they could. So, what are the kinds of things that are needed to make, and where are these facilities? So that if a mother knows that this is a problem, where can they get help in Nigeria without having to take them abroad?
Nigeria,
Because now
yes.
with the rate of foreign exchange, it's not so easy.
So the centers that do heart surgery in Nigeria, definitely Babcock is one of the forerunners. There's also, I know heart surgery for children is being done at OAU and also in Lagos at FCC. Babcock actually is one place that's invested in lots of money to set up a cardiac center, and they actually went to great lengths to set up a cardiac center, where I worked there for 7 years, and there's a lot of work that has been done there. The work still continues. They are dedicated with its surgeon, anesthesiologists, intensive care people. What is the limiting factor to people getting there is usually um, funds, even though they try to bend over backwards. But at this, so because there's some specialized equipment like the heart lung machine that needs to also to be maintained. There's different anesthesia equipments, the ICU ventilators, and all those things need to be continually maintained, and it takes funds to do those things. Those are things that make heart surgery expensive. So anyone that wants to help really in a big way can help with making sure that they
Supporting.
still keep a high
Yeah,
standard of equipment.
it's kept in Babcock. That'll be wonderful. We'll talk about it later. Mrs. Kazeem, we want to appreciate your being on this call. Thank you so much. Can you just tell us about your feelings and your experience? What happened when you found out your child had a congenital heart disease, how you went through it, and now your joy that the issue has been resolved?
I was referred to Babcock Teaching Hospital because my baby was a preterm. So during several tests, they discovered that he has a congenital heart disease. Hello, ma?
Yes, nobody listening to you. Please carry on.
So it's a bitter experience. Before the doctor give the explanation about it,
Yes.
They already take away these fears in me, as it's common in preterms, that there should not be panic, that everything is going to resolve on its own with time without any surgical operation.
Mhm.
So after several drugs and like that, but at the end I give thanks. Everything resolved on its own.
Fantastic. I said, what were the challenges you experienced? Apart from the fact that he was very small because he was preterm, did you have issues with
Okay.
breastfeeding?
I can't breastfeed. I can't breastfeed him by then. They just require for breast. I pump.
Okay,
They
you
just
pumped
request
the
for
milk.
breast milk. Yeah,
Okay.
I can't
But
breastfeed him.
did you notice the coloring in him, or was it the breathing? What did you notice most about the condition?
I can't say because I was operated. You understand? So
Okay,
immediately,
so you had a
so
cesarean.
yeah, as a cesarean operation.
And we want to appreciate your coming on. I'll just want to go back to Dr. Ayeni and have him wrap up for us. So thank you so much for your input. I know you want to go back to the baby now, and we want to appreciate your being here. I want to thank God also for your baby's life. God bless you.
Thank you.
Dr. Ayeni, can you tell us, her baby was preterm. Was there any way it could have been predicted that this problem would happen? I mean, she's fortunate to have gotten to Babcock, on time. But, for anybody else, how would you want to prevent some of this kind of issues from occurring?
Some of the congenital defects can be known before birth, but some cannot be known. But one thing that I will say is a game changer is antenatal care, because there's a lot that can be gained from antenatal care. The patient or the mother will be able to know certain things ahead that could have put her at risk. And so she'll be careful of those things. She'll be counseled and educated on what kind of supplement she may need while pregnant, the kind of things she should avoid while pregnant. All those things, when somebody takes note of that, some can be prevented. And then if ultrasound scan is done, for example, which is a regular thing in pregnancy, up to 3 can be done. Some will detect anomalies early, and knowing them early will help to prepare for appropriate intervention. There are some defects that are incompatible with life or that are life-threatening to even the mother. In those cases, it may be appropriate to just let the pregnancy go. But in Nigeria, it's not legal to abort, apart from when it is life-threatening or it is incompatible with life. So what knowing ahead will do for us is to help to know what to prepare for. Because we can now say, okay, these are the things we have found. This is suspicious. Okay, so let's do this further test to confirm. And now that we know, these are the things we should prepare for, whether the woman can deliver in a certain place or go to a cardiac center, things like that need to be known. So
Okay.
knowing ahead, very important.
Very important. So now, time is fast spent, and so we need to just wrap up. Do you have any last words for our listeners? And in your last words, can you just give us any foundation for example, if there's anybody out there who wants to support the cardiac work and congenital heart fixing that is being done at Babcock? Do you have a number that they can call? Is there anybody they can reach out to support some of these babies?
Okay, a number to reach in Babcock University Teaching Hospital to give support for any patient with a cardiac condition is 0706 239 8941.
Please
That's the number of the
repeat.
Director of Clinical
Please,
Services.
please repeat.
0706 239 8941.
Fantastic. Thank you so much. Dr. Sanusi, any last words?
Yes, so the care for congenital heart disease in Nigeria has really improved. There's still a long way to go. There needs to be a lot of support for these children from, I think, um, the state and the federal governments, because a congenital heart disease can be very devastating for the family. It has been known to bankrupt families. And worse still, it can cause a lot of friction between couples because they just don't know what to do, and the child is so sick. So without appropriate help, and a it can be really taxing on the family. So they usually need a lot of support and help, and that's um, where well-meaning individuals, organizations, and especially the government can come in to support. Sometimes there's good results from this can be cured if it's taken care of timely. Thanks.
Thank you. Thank you very much.
Thank you for watching. Please like, share, and subscribe for new video updates.